Hi class, in this lecture we are going to discuss chapter number 18, which is vaccine and sera. So this is chapter 18, vaccine and sera. Why do we give vaccine? To stimulate and produce antibodies and to protect ourselves from infections, right? So these days we have COVID-19 vaccine going on. And why do we take it? So we don't get infections, right? So what do? They strengthen our immunity. So to they basically make antibodies to facilitate an immune reaction and react specifically with toxins produced by invading pathogen. What are different types of immunity? You have an active immunity and one is passive immunity. Active immunity is body recognizes a foreign protein and begins producing antibodies to react with it. And passive immunity occurs when the performed antibodies are injected in the system and react with the specific antigen. Immunization. What is the definition of immunization? The process of artificially stimulating active immunity. Expose the body to weakened or less toxic proteins associated with specific disease-causing organisms. Goal. What is a goal? Goal is to cause an immune response without having patients suffer the full course of disease. There are different kinds of vaccinations such as diphtheria, pertussis, tetanus, DBT. People who have children, you guys know you take your children for vaccination. These days, the very famous is COVID-19 vaccine. Then we have other ones, which is Haemophilus influenza B, hepatitis A, chickenpox, poliovirus, meningitis, measles, mumps, rubella, or also called as MMR, and rotavirus. All right. Vaccine indication. Why would you want to give vaccine to your patients? To stimulate the active immunity in the patients who are at risk. The vaccines that are indeed depends on the exposure the person will have to the pathogens. Vaccines are thought to provide lifelong immunity. Contraindications. When would you not give a vaccine to a person? When they are pregnant, when they have a presence of immune deficiency, means their body does not have enough fighting factors. So if we give them those vaccines, that would not help them. If they have allergies, patient receiving immune globulin or who have received blood or blood products within the last 3 months. And caution with the history of febrile convulsions or cerebral injuries, conditions in which the high fever could be dangerous or acute infection. Vaccines adverse effects. What are the adverse effects of vaccine? Fever, rash, malaise, chills, fretfulness, drowsiness, anorexia, vomiting, irritability, pain, redness, swelling in the injection site. Drug-to-drug interactions are immunosuppressants. Then, a question, when are the vaccines contraindicated? So when the patient is immunostimulated, when a patient is over 70 years of age, when a patient has received a transfusion within the last 3 months, when a patient has allergic rhinitis. So the answer is C, when a patient has received a transfusion within the last 3 months. All right. The immune sera. What is immune sera? Sera that contain antibodies to specific bacteria or viruses. So this is already pre-prepared antibodies. So we don't have to, your body doesn't have to make antibodies, but it's already pre-prepared antibodies. What are different types there? It could be antitoxic kind or antivenom kind. So immune sera that has antibodies to specific toxins that might be released by invading pathogens to venom from spider or snake bites. Immune sera, what is the action? It provides a passive immunity to a specific antigen or disease. When do we give it? Prophylaxis against a specific disease after exposure. It may lessen the severity of the disease. And so those are immune seras. Contraindications, when would you not give it? Pregnancy, lactation, remember that those ones are just for specifics for all, just vary for everything. Then coagulation defects or previous exposure to immune sera. Adverse effects include rash, nausea, vomiting, chills, fever, allergic reactions, chest tightness, decreased blood pressure, difficulty breathing, local reactions, swelling, tenderness, pain, muscle stiffness at the injection site. Drug-to-drug interactions, immunosuppressant drugs. Question number 2. Patient teaching in an important part of administering immune sera to a patient of the statements below, which of the following is the most important? Improve patient compliance, include the patient in creating the plan of care, educate the patient about process of treating adverse reactions, educate the caregiver about drug being administered, improve patient compliance. Okay, so this basically is a little review on vaccines and sera, and so this was just a little small area of vaccines. Why do we give vaccines? To improve our immunity. We know that you guys all know that we immunize our children. We go for increasing our immunity. A person should have strong immune cells to fight the infection. So certain vaccines are live vaccines. If a person has low immunity, we don't give them live vaccines, meaning that would cause them more infections. So and to improve and improvise your immunity, we give them vaccine. All right. So vaccines and seras, and some of them are pre-made antibiotics, and they come as immunoglobulins. And there are disorders such as, what are those disorders? There's autoimmune disorders. Sometimes we give them pre-made antibodies, such as Guillain-Barré syndrome, GBS. So with Guillain-Barré syndrome, we give them pre-made antibodies, or immunoglobulins. So those are part of seras. So those are some examples on this area. Thank you for listening. This is part 2 for immune modulators. All right. Okay. Thank you.